Kamusta sa team? It's Good to Know Wednesday! This topic is part of the PIPIN initiative and our focus is the FAST hug. FAST hug is a term coined by Jean Louis Vincent in 2005 to address the key issues of critically ill patients. So let's get acquainted with the letters. F stands for feeding through oral, enteral, or parenteral route. ICU patients will not be able to signal their hunger, whilst those very sick in HDU have decrease in appetite or are placed on meal by mouth. Our role as ICU nurse is to advocate for the patient's feeding as soon as possible if not contraindicated, ideally within the first 48 hours. We need to ensure our patient receive adequate caloric requirements as this prevents malnutrition. Gut health is also influenced by good hydration. Remember, decreased fluid intake is equal to constipation. A for analgesia. We can always expect that our patient is in some kind of pain from the treatment and procedures we provide. We should actively strive to manage our patient's pain and promote comfort, as this will help improve the patient's physical and psychological well-being. For mechanically ventilated patients, we can assess pain using CPOT or BPS and provide analgesia as needed. S for sedation. Adequate sedation is said to be the core components in critical care. The 3 C's will help guide this. Is my patient calm, cooperative, and comfortable? If yes to the 3, then the patient has adequate sedation. Ask the ICU team to document the desired sedation score. The Richmond Agitation Sedation Scale, or RASS, is used in ICU to measure the quality and depth of sedation for mechanically ventilated patients to avoid under and over sedation. Thromboembolic prophylaxis must also be reviewed and initiated. Ask yourself, is my patient in any form of prophylaxis? Critically ill patients are at a major risk of VTE due to blood vessel damage, coagulation disorder, and decreased mobility leading to venous stasis. We need to be involved in preventing DVT through mechanical, pharmacological, or early mobilization. H is for the head of bed elevation, which should be greater than 30 degrees unless it is contraindicated. Head of bed elevation is associated with decreased mortality in ICU patients, as it helps decrease ventilator-associated pneumonia. It improves oxygenation, helps mobilize airway secretions, and is also known to decrease reflux and subsequent pneumonia. U for ulcer prevention, as critically ill patients have a high incidence of stress ulceration and are at risk for gastric bleeding. We can expect that if our patient is placed in meal by mouth or intolerant of feeding, that they should have PPIs ordered, and is usually seized with adequate nutrition. If no PPIs are ordered for your patient, do not hesitate to ask the team. And lastly is the glucose control. Hyperglycemia is pro-inflammatory. It also makes a sick person more susceptible to infection, whilst insulin has anti-inflammatory effects. We should also monitor our patients for hypoglycemia and commence feeding as early as possible. So, let's make it a collective effort to give our patients a fast hug per shift. Paalam!